Well, there are a number of side effects that come with the COVID vaccine, some that might not have been listed on your take-home sheet after you got the shot. But for women, experts say you may have noticed a change in your menstrual cycle. Dr. Andrea Friel, gynecologist at North Florida Women's Care and chief medical officer at Tallahassee Memorial Healthcare, is with me now to talk about this. Good evening, Dr. Friel, and welcome to BNC.
Hi, good evening. Thank you for having me.
And yes, Dr. Friel, some women and even female doctors have shared their experiences after getting the COVID vaccines of heavier periods and irregular bleeding. Do you know what is actually causing this?
Actually, there currently is no good science supporting that, and it may be coincidental. We do realize that when patients are getting their vaccination during their menstrual cycle, women sometimes have extreme fatigue or tiredness, and some of the side effects happen to coincide with the vaccination. We don't recommend delaying vaccination just because you're on your menstrual cycle or based on any current recommendations. There is no strong facts regarding irregular menstrual cycles and using the current vaccinations. So we do continue to recommend that you get your vaccinations, and we'll monitor and track this. I think that in the back of people's minds, what they're thinking is, does this affect my fertility, or is something else happening to my body with respect to our menstrual cycles?
Yeah, certainly.
And so
and I was going to say, yeah, we're going to address that as well. But I wanted to ask you this. You know, there has been evidence in the past that showed both the flu and HPV vaccines can have an effect on people's menstrual cycles as well. Is that pretty much the same as it goes for the COVID vaccines?
That could definitely be true. And what's important to realize is that your body's immune response does affect the way that your body may respond to having, menstrual cycles, but they should go back to normal, or they should not be a long-term effect that is happening to women.
Mm-hmm. And what are some of the reports that you have heard of? What have women been saying?
The most that I hear is that they feel more tired with getting the cycle, or they may skip a cycle, or that it's delayed a few days. But there has been no consistency. And even with the patients that do experience that, it has happened to them in the past. So it's difficult to, we will continue to monitor this information. It's an important thing to report it to your physician so that we can track this and find out more information. But the side effect of perhaps having a longer or heavier cycle, or perhaps skipping a cycle, or it being delayed, should not have long-term effects on our menstruation or our body organs, because remember, the vaccine does not actually enter our DNA.
And Dr. Friel, we just touched on this a little bit. We spoke about this a great deal when the vaccinations were first made available. Have there been any signs recently, now that we're months in, that vaccines will impact fertility?
Currently, there's no basis for that. And there was a nice public announcement put out by the World Health Organization this past June 4th, explicitly discussing that the concerns for fertility, and regardless of male or female gender, it's not substantiated, simply based on the fact that these antibodies are against the spike protein, or working with your immune system, and should not have effects on your reproductive organs.
And so talk a little bit about some of the other things that women have reported experiencing after the vaccines.
Sure. Most of the same, outside of being a woman and the menstrual related concerns that they have, the other same feel more prevalent lymph nodes is another one that can sometimes be concerning. Lymph nodes are those little that when you have a lymph node inflamed, it can be kind of scary, maybe even up to the golf ball size. But that is a sign of your immune system working. They do go away, and and aside from fatigue and otherwise having some of the mild symptoms of body aches and maybe slightly elevated temperature, or even some women have experienced feeling a little bit of tachycardia, which is an elevated heart rate, are also side effects that you should report to your provider if you have those after having the vaccine.
Any recommendations that you would make to these women who have kind of experienced those things? They say that they're worried about it. Of course, they're reporting it to their doctors, but is there anything that they can actually do, or we can actually do?
Absolutely. Just continue, they're self-limited and should go away on their own. And it's important to realize that. So the first thing you should do before even getting the vaccine is to continuously read on these possible side effects. Because if you know that they may occur and you know that they're self-limited, then if it doesn't resolve within 48 to 72 hours or within a week, you should definitely report that to your healthcare provider. So I think the most important thing is to make sure that we continuously report possible side effects as well as just make ourselves aware.
And when people are coming to your office, is it something that right now that you're recommending that, hey, you should still get vaccinated even if you have these types of concerns?
Absolutely. It is an individual choice. You should educate and have that discussion with the healthcare provider because it is important. This is one of the only tools that we have to help eradicate this pandemic. And so if you are a candidate for the vaccine, you should definitely take it. Certainly there are people that have instances where they may discuss with their physician that they cannot. I don't practice obstetrics anymore, but get plenty of questions from pregnant patients that would want to know if they are considering having a baby or if they are pregnant, should they take the vaccine? And currently it's recommended that we do not withhold the vaccine from these patients. But it's important to get the information and do what's best for you and your body.
Yes, definitely very important. And Dr. Fryo, I remember during the pandemic, a lot of folks couldn't obviously go into their doctor's offices or go to see their gynecologist regularly. Have you noticed that people have started to go back and make those appointments and taking care of those annual exams like they need to?
Absolutely, and I'm glad to see them back. I'm very happy that pregnant women did not defer their care. We've made, lots of different maneuvers in the offices to be able to safely take care of pregnant patients. And kudos to all those OBGYNs and frontline workers that were out there helping these pregnant women. The one thing that we do realize is that sometimes this is a specialized group of patients that not all adult medicine and pediatric medicine apply to. And so we have to take special consideration when it comes to women and babies and how best to treat them. But luckily, our pregnant ladies, we were able to continue to accommodate them and they did not delay their care.
That's awesome. And it's so funny because I know so many people who are currently pregnant right now. I don't know if it's bringing on the baby boom in the pandemic, but even both of my nieces are having babies, so it's all good information for them. Is there any message that
congratulations.
Thank you. Is there any message that you would want to send to some of those folks who are still hesitant because they're hearing about these side effects, just to make them feel more comfortable?
Absolutely. I do think that it's important to do a couple of things. Number one, continue to speak with your healthcare provider. Also, trust the science in a sense that use trusted resources. The CDC website is also a wonderful place to be able to have information delivered in a way that's easy to understand. So it's important to have facts and trust your healthcare providers and being able to kind of help you maneuver through these situations. You trust your accountant, you trust your real estate agent, you trust people that specialize in their areas. So use your healthcare workers to help guide you through this pandemic.
That is so important. I hope all of the other healthcare workers are hearing this and knowing that we got questions, and I hope they got the answers, or we're sure they have the answers.
We'll try our best.
Well, Dr. Fryo, thank you so much for your time. We appreciate it.
Thank you.
Take care.